Okay, so doctor, now these are the initial days of the baby. What are the kind of health related concerns that they could have? For example, colic, gas, maybe sneezing, coughing, you know, anything else that I might be missing out upon. So if you could, throw light on those things, it would be really nice.
So a lot of common, concerns of the families are what we call as physiological or normal for the age. So sneezing is usually related to, any change in the environment, like any temperature change. If the baby is having, being in the AC for a long time, some perfume from somebody's clothes, some sanitizer smell sometimes. So it's usually nasal irritation that causes the baby to sneeze rather than a cold. And often parents ask that baby ko sardi ho gaya, but it is never a cold. And sneezes couple of times in a full day are pretty normal. So there's nothing to worry if the baby is sneezing 3-4 times in a day. But if it is very frequent, then we need to figure out that what is irritating the nose for the baby. Hiccups are actually a good sign. So hiccups happen when the stomach, which is where the milk goes in, is little big and it touches a muscle called the diaphragm, which is separating the lungs and the tummy. So whenever that stomach touches the diaphragm, you hiccup. So even in olden times, the grannies or grandmas used to say that hiccups means ki baby is full. So hiccups are something that you don't need to worry at all. They just appear very deep because the baby is so small. So it appears like a big jerk, as if the baby is in trouble. But hiccups are quite good. You just need to hold the baby upright and it goes away in a minute or two. Apart from that, crankiness, crying is like a very common problem. What to do when a baby is crying? So 4-5 things need to be checked as a basic. So has the baby passed urine, motion? Is the diaper wet? Like, is the baby uncomfortable? Apart from that, obviously hunger. So is the baby crying for hunger? And sometimes it's the temperature. Sometimes it's holding. So what I tell them as a parent before they go home is that if somebody has carried the baby, what we call as a consolable cry, it's not a medical problem. If you're holding the baby, feeding the baby, baby screaming, it's been like 5, 10, 12 minutes, then only you start thinking of something which is not a typical thing. So colic is a painful form of gas, what we call as a cramp, like a minor cramp. So the baby might, cry out a little bit, but that also is very much consolable. So regular colic, when hold the baby, pacify the baby, it should settle down. So these things are very common. Mild jaundice is also very common in the first 3-4 days. The baby's face, eyes might appear light yellow, and the doctor at discharge will give you some, symptoms to look for. If the feeding is good, weight gain is good, and if the yellowness is not, looking that it is spreading to the thighs, legs, means it is mild jaundice, which lot of babies would have. And there would be a follow-up after discharge, so make sure you go for that follow-up visit, because that is exactly to check whether the jaundice is in range and the weight has not dropped a lot. So after discharge, there is usually one follow-up visit that is always kept for all newborn babies.
What would be a panic? What way all this is going on? Anything which is a panic button that the parent has to press and bring the baby immediately to the hospital, or
Correct.
they can deal with it themselves.
Yeah. So newborn babies never get fever. So if there is a true fever, most commonly when parents tell that the baby has fever, they have actually overwrapped the baby. So there are big blankets in a on a hot Mumbai day, and they have just bundled the baby, and the baby feels very warm. And by the time we open it, wait for like 2-3 minutes, check the temperature, it's all okay. So fever is a red flag if it is a true fever, and we check fever with a digital thermometer in the axilla, just like you would for an older child. And above 99.5 is considered fever. So if there is a true fever and the baby is not overwrapped, then that's a warning sign. A lot of babies spit out a little milk. It's called a reflux. So milky or curdy reflux is normal. But if the vomiting or the color of the vomit is green like a spinach, or very dark yellow, or brown like a coffee, that's a red flag. So that's the second warning sign. Breathing, fast constantly, what we call as breathlessness, is a warning sign. Some babies might do a few seconds of fast breathing. That is okay. That is called periodic breathing. So it's a few second fast breathing, then it settles down. So that is allowed. But if it's constantly fast and the baby, what we call as, looks distressed with some grunting sound, so that is not usual. And cyanosis, which means bluish color of the lips or the fingertips, which means that the oxygen levels might be a little low. All of them are very rare. Any continuous abnormal movements like a jerky movement, which is constant more than 30, 40, 50 seconds. So these 5-6 signs are the only things that you need to sort of what we call as a warning sign, and this needs to be immediately addressed by a doctor or a trained team.
But these are very rare.
Extremely rare, extremely rare. Yeah, yeah. And actually, actually we tell them these signs so that they don't panic with the other signs, because there are, for these 5, 6 warning signs, there are more than 50 normal or minor signs.
But any which way they would be in touch.
Yeah,
With
absolutely.
the plus they would have regular checkups few days. So
Yeah, definitely. Yeah.
well taken care of.
Yeah.
So doctor, now that takes me to a very important part of a baby's regime, that is the baby skincare. Um, what according to you, or what according should a mother follow? Like, there is there's so many shampoo, so many brands today introduce some shampoo. So what is it that a mother should actually look at when they're looking at skincare?
Correct. So immediately after the birth, the baby is covered by a very natural moisturizer. It's called Vernix. So it's like a thick white, creamy material. And we as doctors have stopped bathing the child immediately after the birth, because science has actually told us that this natural moisturizer, or the skin coating, is actually very helpful. So it slowly melts over 1 or 2 days. It's like butter. It's white in color, and babies are smeared in that. So that actually protects the skin in the tummy. Because if we were to put our hands under water, our hands would, the skin would wrinkle up and it would get. But imagine a baby is in water, amniotic fluid for so many months. Still, the skin is so shiny and intact. So this natural covering is the best initially. So don't be in a hurry to wipe off and have a clean baby. That naturally sort of clears up as you sponge the baby, over the next 2, 3 days. Once the baby comes home, the skin is very delicate, and usually they just need like a simple oil. Coconut oil is considered very mild and very good. It has some anti-inflammatory properties, so that is very good. Some places traditionally use almond oil, which is also okay. So these two are generally mild, non-harsh oils. And your belly button umbilical cord doesn't fall off for the first 7 to 10 days. So you don't want to dip your baby in water or have like a very rigorous bath routine in the first few days. Sponge baths are very much allowed, and gentle oiling is fine. And once the cord falls, the umbilical cord, which would typically be by 5 to 7 days, after that, bathing can start. And bathing can be done in 2 ways. You can do a tub bath, like many people do, or you get those baby bathers where, the baby is kept and you bathe the baby. Before bathing, you can do a gentle oil massage, and post bathing, a mild moisturizing lotion can be put. So a scent free or a non-perfume moisturizer can be put after bathing, because after bathing it absorbs well in the skin. So that essentially is like 90% of skincare. You don't need any other fancy products initially. You don't need too many, lotions or serums or body milks or whatever you call them. And a mild body wash. The pH of the newborn skin is 5.5. So you need to just check that whenever you buy a soap or a body wash for the baby, that it says pH 5.5 and it is fragrance free or scent free. And you can use that, right, once you start bathing the baby, that can be used. Talcum powders are a strict no, so they inhale the talc in it. So talcum powders preferably avoid for the first 3 months. A good diaper rash cream, if you're using diapers or cloth nappies, sometimes babies pee and poop and the skin can get abrasion, or there could be some injuries there. So a barrier cream which is applied there is helpful. Apart from that, for the skin perspective, there is nothing much. The baby skin is very shiny, it's very soft, and with every month you can see that the skin becomes a little more less sensitive rather. So it gets a little thicker, more and more layers get added to the skin. So it needs to be moisturized, it needs to be kept clean by bathing, and you need to avoid abrasions and rashes. So the neck area, the diaper area, armpit. So wherever sweat accumulates, that's where sometimes rashes can develop. So you need to keep these areas dry.
What about the Uptons, doctor? Nowadays, there's a huge fad going around. I don't know if it's a fad or it's required. Face Uptons for babies.
Correct. So most of the patients end up coming to the hospital because most of the Uptons cause a reaction. So it causes a dermatitis, what we call it. So dermatitis is essentially a skin reaction to any product that is applied. So definitely not in the first month or two. So, and lot of, the Indian traditionally they say ki body has hair. So they want to rub it with besan or multani mitti or something like that. And it often leads to rashes. So those hairs are very thin. If actually the baby grows for 1 or 2 months, you notice that those hair become golden. They are not seen much. So what they are the hairs that would actually fall off sometimes in the mother's womb only. But sometimes the baby has come a little early, so they haven't fallen. So they just need to be left alone. You don't need to do anything to, scrub them off or remove them. So we don't recommend any uptons or anything for the face. Most of them actually cause some dermatitis.
So it's good to keep the baby as natural as possible.
Absolutely.
Not to get him to, heal. Like, it's better to keep the baby as natural as possible.
Yeah, yeah.
Now, doctor, moving on from here, what about clothes? Like, what kind of clothes should the baby wear?
So practical point of view, lot of the clothes, I tell them two things. One is that soft cotton clothes, which are breathable so that the baby doesn't sweat too much. So that is one. Things that go over the head are very inconvenient because the baby's neck is not, there's no neck control. So it's always good to buy things that can button up. So you don't have to, lift the baby and put thing over the head, because that makes it a little uncomfortable for the baby to put and remove it. Because you might have to change the baby like 5-7 times a day. They might have a spit up and spoil their shirt, or they might, sometimes pee outside the diaper or their clothing. So you need to change the baby frequently at times. So having simple cotton clothes which are buttoned, easy to button, onesies that are now, you can button them up, and having thin swaddle. So layering up is better than having thick blankets. So rather than having one thick blanket, it's actually better to have two thin swaddles, because you can always reduce the layering. Whereas if it's a thick blanket, you are either too hot, and once you remove it, you might be too cold. So yeah, so avoid fancy clothing. There is no role for having shoes.
Now there is something which has come up called as eco-friendly clothing now.
Correct.
They say that the prints are very eco-friendly. Are they really? I mean, and they're expensive. Are they
Correct.
something that one can consider?
So you can use that for like a function or a photo shoot or during some occasions. I think for daily wear, non-printed clothes, simple cotton ones are usually good. So you don't need to have like eco-friendly or fancy finishing or bright design. So for short time it's okay, but finally your baby should be comfortable in what he or she wears.
So Dr. Let's move to the next question. This is about baby sleeping. So in the conversation we had discussed that we keep the baby sleeping set, we keep a separate cot for the baby, but there's also a lot of conversation that the baby should sleep with a parent in the same bed. So could you throw some light on that?
Correct. So that is again a little bit of a controversial discussion in terms of what is scientific and what is for bonding, emotional things. So in Indian setup, traditionally babies and mothers have slept together, for many years, because of these cribs were not available and the space and lot of things. What medically, the American Academy of Pediatrics and the Western guidelines recommend is that there is a little bit of worry if the bed is crammed up. If the mother, baby, dad, or they all sleep together, there is a risk of SIDS, or sudden infant death, what we call it, where the baby can hold their breath or something, because the mother, it's like a short, small area. So little bit of suffocation, like nobody knows the exact cause, but some instances have happened. So the medical recommendation from the Western countries is that the mother and baby sleep in the same room, but on separate beds, and the baby's crib can be, on the side, but in the same room. Practically, lot of that makes sense, because then you won't sleep lying down, which is also not very good in terms of ear infections and aspiration, choking sort of episodes. In sleep, when you hold the baby at the breast who's very young, is probably not the best idea. So if the baby is on the other cot, obviously the mother has to get up, sit down on a feeding chair, hold the baby and then feed, then put the baby back to sleep and come and sleep. So that cycle sort of is like a safety recommendation from guidelines. So what you asked about co-sleeping, so that is important for the baby's emotional development, what we say. So, I have co-slept with my kids, but when they were a little older. So once their, neck control comes, once they start rolling over, that is when they can, probably safely sleep next to you, because you don't, want it to be all crammed up. So co-sleeping versus in the Western countries where, the kids sleep in a separate room, I think that's a very personal choice. And there is no scientific strong data to say whether one is better than the other. There are, kids doing well both ways. So it's a very personal family choice. So we leave that to the family. But what I think on online, whatever content is coming saying that co-sleeping is good, is probably after that age, once the baby is rolling over, controlling the neck, so that safe sleep guidelines are not confused to be with. So the American Academy says sleep in the same room but on a separate crib for the first full year actually. But I would say once the child is rolling, turning over, say by 6-7 months, probably it's okay to go sleep with the child if that is the choice that the family wants to make.
So, Doctor, coming to a very important question about usage of mobiles with babies. Can you throw some light on that?
So that has been a constant, a pain for all doctors because we have post-COVID, we have seen a sudden surge in kids with speech delay, autism, and all because of kids were indoors, lot of exposure to screen time. So screens are a very overstimulated, sort of a device. It's bright, it's attractive. So a kid who can start seeing is naturally attracted to it. You see so many colors, noise. So it is definitely harmful for the kid. So up to 18 months, strictly no screen time, not even any video. Even video calls should be minimized because that attraction to the phone develops naturally. As the child grows, they model your behavior. So, kids sees that my mom is on the phone, dad is on the phone. So for them, it's something that is very important. Their most important person, which is mom, is, looking at the screen. So definitely it has to be important. So that gets ingrained in the child's head. So please keep all devices away. Even I remember for the longest time, for 2 years, we didn't have any TV or cable in the house when our kids were young because even if it's an adult show going on, they are naturally going to sit and listen. Yeah. So even when you're feeding, when you're breastfeeding, they shouldn't have a mobile. Absolutely not. Yeah.
Doctor, a very quick question on skincare. Should mothers use wet wipes? And what about diapers? What should they use? Cloth diapers or disposable diapers?
So water-based wipes are safe. They can be used. They are convenient during travels, visit to hospital. So, they don't cause lot of mess. At home, once the child is older, you could just use water. You could just use warm water to wash. If the skin is very sensitive, then you can use some cotton balls which is dipped in warm water to clean so that it's more gentle. So you don't keep rubbing it. So that is one. Always clean it from the urine area to the stool area. So it has to be cleaned from front to back. So you can't clean from back to front because the stool has all microorganisms, bacteria, even some microscopy that you can't see. So that shouldn't come in the urinary area because that can cause urine infections, and change frequently. So frequent changes of diapers whenever you feel it's soaked is necessary because the modern diapers are very good quality. They can absorb 3-4 P's until it gets full for the baby, and then the baby might cry. So if you're using diapers, change very frequently. Cloth diapers are also fine. They are good. They are a little bit more environment friendly. So they're easy to wash. So you can choose. It's again, you can choose either, whatever is convenient. Even simple langots, just cloths can be put on for the baby.
So you recommend baby detergents?
So the baby's clothes should be washed separately. So you can't put our adult clothes with the baby, that has sweat and bacteria again. And a mild detergent for the baby, which is not toxic, is better because all adult detergents are very strong. So sometimes when the baby puts them on the skin, it can cause a rash or has. A lot of parents ask, should we put Dettol? And it's a strict no. So no harmful chemicals or strong chemicals for that matter are needed for the baby's clothes.
Doctor, moving on to very interesting topic is a baby brain development. Could you please, tell us more about it? How does the baby brain development in terms of the emotional quotient of the child and overall about brain development?
Correct. So the baby's brain is, in a very rapidly developing stage from the first 1 year. So maximum fast, speed of development of the brain is from 25 weeks to 40 weeks, which is in the womb. Then the first 3 months, it's again fast. And then till 2 years, there is again very rapid brain development. And what actually happens is that there are connections that are constantly being built between two neurons. They are called synapses in medical terms. So if the baby gets a good stimulus, mother is holding, touching, one nice wiring has happened between the two neurons, which the baby now recognizes as a soothing or a comfort touch. Suppose there is some harmful stimulation, like a baby has to, unfortunately have a prick or a blood test in the hospital or some sort of discomfort. then a negative neuron is joined, or a negative connection happens. So these connections are happening at a super fast rate, like millions and millions of connections are happening, and some of these bad connections can actually also rewire. So it is not that it's permanent if some a negative stimulation has happened. So it's very, very important in the first week, few weeks, months, that the baby is in a very happy space, in the comfort with mom, dad. And what is going to improve these connections is whatever they can intake. So their sensory input, what we call it. So their vision. So the vision is actually quite blurry for the kids, but they can see contrasts. So you get these flashcards, nice black and white, colorful cards, which are very, very, having high contrast cards. You keep it near the baby at a distance of a feet, because they can't see something that is very far. And then the baby focuses on that, and then you move them apart. So that is your visual stimulation. Hearing is quite well developed right at birth. So hearing the mama's voice, singing lullabies to the baby, having some very soft music, so they can hear, and their attention, you can see, immediately is shifted once they hear to that soft soothing music. So that is your auditory or your hearing input. Skin sensations, again, they are very well developed. So whenever you feel that the baby is being touched, skin to skin contact, all that is again a very positive stimulation. So all you can give feedback to the baby is positive feedback by these 3-4 input signals for the brain, and you minimize the other negative things for the baby. So avoid very bright lights or sudden changes in light, sudden loud music. Lot of parents ask that, can I take my baby for a movie, or there is a function down, DJ is playing. So avoid all those negative stimuli, improve the positive stimuli, because all the good neurons will get connected. Good sleep also, that's when the brain grows even fast. So singing to your baby during sleep, keeping the room a little dark. So all these things help a lot in the brain development for the baby. So, and it's extremely important. It's very easy. You actually don't need anything fancy to, do that. And once 2-3 weeks have passed, maybe after 2 weeks onwards, you can start some supervised tummy time where you're with the baby. So tummy time helps the baby, hold the neck. It's like a little exercise for the physical thing for the baby.
So I think, thank you very much, Doctor. I think this has been a super insightful conversation with you. And of course, it's answered a lot of questions which I'm sure parents have. If there's any important answer that you need to, share the parents, or we just wind up the session with that tip for the parents.
I think always, feel free to communicate. So again, communication is this key. Lot of parents and mothers are very anxious, and then they think negative, that something is wrong. So just reach out to your doctor, pediatrician, your parent, your sibling, so that, you're not in that internal suffering and guilt, because it is an overwhelming phase, this period. So just, I think clear communication is the key. Yeah, and I think I had a lot of fun, having this conversation with you.
Same here, Doctor. Thank you so much, and hope to see you soon.
Yes, my pleasure.
R for Rabbit, the amazing baby company.